Welcome back, everyone, to Vertical Thoughts. Thanks for joining us today. First of all, I want to let everyone know that there is not going to be video on today's episode. So if you're watching on YouTube, you can go ahead and just look away. There's just going to be audio for today's episode. But we know that you all need content in this time, this downtime that you have at home with the COVID-19 things that are going on right now all over the world. And so we wanted to do our viewers a favor and kind of break down a little bit what's happening all over the world and answer your questions. So we submitted a request online to all of our listeners via Instagram for questions about COVID-19, about coronavirus, and about what's happening in the world and what we as climbers should do. And as many of you know, Brooke works at a hospital. And at that hospital here in Temecula, at Temecula Valley Hospital, there is a gentleman by the name of Jake who is the head of infectious disease. We've got in touch with Jake and had him on our show today, and Brooke has interviewed him and asked him your questions. So rather than just having us spout our opinions and the things that we think or we feel about what's going on, we wanted to get an expert opinion and someone who can answer your questions accurately. So no video for today, and we apologize for that, but go ahead and without further ado, Brooke, take it away.
So today we're joined by Jake. He's actually a colleague of mine. We work at the same hospital. Jake, can you tell us a little bit about what your role is at the hospital and what your credentials are?
Sure. Yeah. Thanks for having me, Brooke. I'm the director of infection prevention at Temecula Valley Hospital. I've been there a little over 2 years now, and I oversee all infection prevention activities for Temecula Valley, and very, very interesting field. I'm learning something new every day. Absolutely love it.
Yeah, that's awesome. I've actually heard you're a bit of a climber as well. Is that right?
Yeah, definitely. Climbing is one of my primary activities outside of work. I've been climbing for about the last 15 years, going on 16 years now.
Oh, wow. Okay. And so tell us a little bit more about it. Like, what style of climbing do you prefer? How often do you get out? Like gym, crag?
Yeah, I typically hit up the gym 2 to 3 times a week. Try to get out every weekend if possible. Mm-hmm. I like all types of climbing. Just any climbing. As long as I'm climbing, I'm happy. So I definitely love bouldering, trad climbing, sport climbing. Aid is something I've never really gotten into, mm-hmm. but yeah, anything is good for me for sure.
Well, it's awesome. We were actually planning on doing an episode kind of like this already before I found out that you were a climber, and it all just kind of worked out perfectly. I was like, well, we got to have him, right?
Yeah, interesting times for sure.
Yeah. So that's
a nice combo.
In these times specifically, like with the pandemic that's going on, what do your days consist of at the hospital? I'm sure it's a crazy busy time for you. What are you working on every day?
Every day is pretty much totally different. I have some routines. There's dedicated safety meetings in the morning, mm-hmm. and in the afternoon. We also have activated our incident command at Temecula Valley Hospital. So there's a lot of activities that surround those meetings, a lot of action items that come out of those groups. So I spend most of my time in these meetings collaborating with all of the leaders in the hospital, and then executing on the various actions that come out of those meetings. In addition, there's just a ton of case review going on, a lot of patient movement that has to be reviewed and approved, mm-hmm. Constant review of microbiology results and updates that are coming through the lab, in addition to, everything else that I typically do on a day-to-day basis, ensuring safety of all of our invasive devices, surgical site, infection prevention and analysis, and mm-hmm. Of course, hand hygiene monitoring and
right.
and a ton of education too going on right now. Just constantly rounding on staff, getting feedback, fine-tuning where we can, and just trying to keep everybody up to date on all the changes that are occurring. So lots going on, but yeah,
so
it's all good stuff.
So for me, I work an emergency. So every day, right, at least right now, this isn't normal. But right now, every day I come into work, something's different. We're doing something different. We're not allowed to do something new, or now we are allowed to do something we weren't the day before. Are you telling me that's because of you?
No, not entirely. So, there are just many variables to the situation that we're dealing with. One being, well, over the last few months, I mean, even just our criteria for evaluating these patients has changed, gosh, I don't know how many times, and sometimes multiple times in the same week, sometimes multiple times in the same day. And so we have to adjust and adapt our algorithms as much as we can on the fly, enhance our screening criteria. We also have to take into account, our supply chain, which has never really been an issue before. This is kind of unprecedented with the current pandemic. So not only do we have to prioritize our testing supplies and be able to adapt those on the fly, we also have different PPE than staff maybe are used to wearing, and also limited supplies of those. So we have to adjust our protocols and, based on what we're seeing, in some cases, adapt them and get feedback from the staff, and just we're constantly fine-tuning and improving to optimize safety.
Well, thank you so much for all the work that you're doing to keep the public safe as they come in, and to keep us safe as workers. We're there every day. We really appreciate all the hard work you're putting in.
Oh, thanks. I mean, I definitely appreciate you and everything every employee in the hospital is doing. We're getting a lot of good feedback from staff, and the staff are being very flexible and working with us. And I think, they understand the situation too. And, most important thing for them is just to stop and ask. There's been so many changes recently. There's a lot of fear in the community, and it's just important for staff to recognize that they have the support they need, and we can provide them with a lot of resources that we have. So thank you as well. You're on the front line, and you're in there.
Of course,
taking care of these patients. So
it's a job we signed up for, and we're happy to do it. Maybe not everybody saw this kind of thing coming, but we're here for it. So, so we want to take some questions from our listeners. We let them know that we would have you on today, and they sent us in their questions. So by now, I think everybody knows that COVID-19 is a flu-like virus. In most cases, it primarily causes fever, dry cough, sore throat. It can cause some other things too, but those are the primary things. There have been similar pandemics in the past, but none that I've seen cause this degree of effect on society. You and I, we haven't had significantly long lives yet, so but the older generations, I've heard them say the same thing. My dad, I was texting him the other day, we were checking in with each other, and he's like, I have never seen anything like this. I don't know what to think. He has all these unknowns because it's never happened to them before. So I'm curious, what makes this different from things maybe we have seen in the past, like H1N1 in 2009? Why is it different now?
Yeah, that's a great point. And it is, a totally different virus, and H1N1 definitely had a tremendous impact. But even when you're looking at the mortality rates, the novel coronavirus this year is more in line with Spanish flu at best from our 1918 pandemic. So, with the typical flu, we're usually less than 1%. And that's because, we see flu every year, even though there's variations, and we can have novel flu strains develop through, zoonotic or animal transmission. This is just something totally different. And this virus has kind of struck the perfect balance of virulence and transmissibility. such that, it's able to spread very quickly and easily and infect a lot of people because it's something, we've never seen before, coming from likely a bat reservoir. And there have been other novel coronaviruses that have come out, within the last couple decades. So we had the SARS outbreak in the early 2000s, and then Middle Eastern Respiratory Syndrome coronavirus, even more recently around 2014. And again, the mortality rate in those were quite a bit higher.
Right.
And so if you're killing your host, you have less risk of transmission. And then in addition, they just didn't seem to transmit person to person as easily. For MERS, that's actually a Middle Eastern Respiratory Syndrome coronavirus. That's still going on. But it's limited because usually these people are having close interactions with camels, and that's how they're getting it. And then the mortality for that is as high as 34%.
So that's great. I'm really glad you brought that up, because I was actually going to ask you about that. Like, that virus's mortality rate is so much higher, but I feel like our population here has never even heard of it, and it's because it doesn't come here,
Exactly. Yeah.
But that's incredibly deadly.
It is, but less transmissible. And again, the more you're killing the host, the less your risk of transmission. Now with this virus, you can have such a huge range of presentations, and maybe 6% of transmissions are occurring from asymptomatic hosts. So how do you stop something like that, right? Like, we've never been able to stop the common cold before. And even the flu, right? It's something we see every year. We get exposed to it every year. We even have a vaccine for it, and it still kicks our butt every year. With 30 million cases, 30,000 deaths. Yeah. So I mean, these viruses are very good at what they do, and they've been doing this a very long time.
Right.
They're pretty highly evolved. So
before we were around, I'm sure. So
yeah, at least in this state, yes.
you compared COVID-19 to the bird flu pandemic in 1918, and as far as I know, that lasted for over 2 years. I don't know how largely present it was for that entire time, how serious it was for that span, but is there any way to tell how long COVID-19 is going to last in the United States or in our area in Southern California specifically? I think most of the questions we got were when is this going to end?
Oh yeah, good question. So we're in this for the long haul, in my opinion. This is something that's likely going to enter seasonal circulation, and it could be around indefinitely. And by doing the social distancing and all the public health measures that we're taking now, it will help flatten the curve, but it's important to remember that the area under the curve is pretty much the same. So you'll see the same number of people getting infected just over a longer period of time. This could impact 40 to 70% of the population, and it's just going to be with us for a while, let's say. Sorry, I don't have better news, but
no, that's okay.
From my analysis, I think that's kind of what I've been expecting this to do, unfortunately. But
because
the best things we can do is just. Oh, sorry. Go ahead.
Thank you. Sorry. Is it correct that H1N1, like since that pandemic in 2009, that comes seasonally as well with our flu season? Is that right?
Yeah, we see that every year now, and we have a vaccine for it, and again, it's still kicking our butt every year, for lack of better language for you. Sorry, but yeah. So we still see a tremendous amount of H1N1.
So for COVID-19, with the degree that it's at now, if we expect it to come back and kind of stay forever in a sense, come back seasonally. But the way that it is now, like, can we see this ending in a few months, less, more? Yeah, a few months of maybe this acute phase. We're expecting the peak potentially here in California, and it's kind of difficult to project right
at this point, but we're really just getting started with, we're still almost in the initiation phase, and students start seeing more exponential growth locally, at least, with our peak projected really to be around May 1st. And if we're lucky, and that's, again, just the peak, and that's going to be drawn out, and it'll be a little while, at least a couple months until we start to see that taper off. And then, we'll see little pockets flare up over time, throughout the country and in different areas once we start releasing the social distancing measures.
So
and then there'll be travel cases and all that.
So our area right now, our state has a stay-at-home order to try and improve that. But I know that some areas or some states, I guess, don't have a stay-at-home order right now. Is that concerning for you, or do you think maybe they don't necessarily need one?
I think it's better to get ahead of these things. Once you identify the problem with a virus like this, it's already 10 steps ahead of you. So I think, maybe not every state needs a stay-at-home order, right? There's different local epidemiology you're dealing with and population densities and in some of these rural areas. So it may not even be that relevant, honestly, because people are already just naturally distanced by their way of life. But, definitely a lot of the other measures, enhanced education and focus on hand hygiene and just that awareness will go a long way to help prevent this. But, it would just depend, locally on what's going on. But I'd say as much as we can do up front, we should be doing.
Right. Because viruses are, like you said, very good at what they do. They can spread very, very quickly, and before we even kind of catch our feet with that. So I definitely agree.
Yeah.
I think it.
Yeah. We're only seeing the tip of the iceberg.
Right.
With the data we have. So.
And whether there's an order in place or not, everyone should be doing everything they can to stay home and stay away from other people. So.
Exactly. Just staying away from other people. I don't. It's hard to say, that it's necessary to stay home. Certainly for me, and I know for a lot of you and probably your listeners, that it's, being outside is somewhat vital to our well-being. And
absolutely.
But I would just, do as much as you can to avoid others and distance yourself when you are even doing those activities. So.
Right. So pretty much all of our listeners are lovers of the outdoors. So I think that's like the burning question is can we do that right now? Can we go climbing? Is that okay? I think, everyone, the climbing community in general, I think is very kind and respectful and just, all around made up of good people. So I think they want to do well. They want to do the right thing and keep themselves and others safe. But we see people going outside right now. We see Joshua Tree packed. And so it's...
it's closed now.
Thank God. But so some of the quieter, like more remote crags, is that okay? Should we be able to do that right now?
Again, this is a tough one for me because I'm pretty biased in the other direction. And definitely minimize it. We don't want to see huge crowds at these places. And if people are aware of these remote locations and everyone's thinking, I'm going to go look for somewhere there's no people, then those places will probably get busy too.
Right.
But, just, I would say, be as respectful as you can possibly be and try to keep it to an absolute minimum. There's no roadblocks in place in a lot of locations, so you can pretty much freely travel at this point, but there may come a time where you can't.
Right.
And so I would just, of course, limit your party size if you're going out, socially distance. And, in general, we want to minimize our impact when we're outdoors. And, of course, good hand hygiene, respiratory etiquette, and, it's just mindfulness and awareness of, where your hands are and, how these things are transmitted. So as long as everyone has that basic awareness, I think we can do a lot to protect ourselves.
Right.
And then, stay local. Don't go, to a different town where you're more likely to have to go shopping or interact with others. Just quick day trips, if anything.
I think that's the biggest concern and topic of discussion with doing outdoor trips right now is people coming from all of these different locations. Maybe they're not from super far away, like within an hour or 2 hour drive, but still from all these different places and more crowded areas, going to these small towns and using their gas stations and grabbing a coffee or whatever it might be. That's not fair to them, in my opinion, like putting them at risk like that. If we were to get them sick, these are small towns. I think probably a lot of them are not climbers. I think in those climbing towns, they're elderly population, a little bit more like rural area type people, and for them to see climbers as people that brought them this disease that maybe they couldn't handle, like that would really upset me, for us to, as a community, to hurt them.
Oh yeah, absolutely. I mean, again, just being as responsible and as mindful as you can possibly be, and
so like
even if you're using the gas stations locally, wash your hands or sanitize your hands if you can find any hand sanitizer, and again, just that mindfulness and that awareness, and just have respect for what we're dealing with here, and limit things as much as you possibly can, while maintaining some of your sanity, I guess.
Yeah, as much as you can. And about climbing outdoors, if they are a little bit more crowded right now, like the remote areas, or should we be concerned about climbing the same climb that someone, like a different group, just did? Like, can the virus survive on outdoor rock? And should we be scared of that?
It could. It's definitely something to be aware of. And maybe you could get a few hours, but I honestly don't know the impact that a desiccant like chalk would have on the virus. I imagine it would be a pretty hostile environment for the virus, to be dried out and then deposited onto a rocky surface in the outdoors, where you have UV light and wind and different fluctuating temperature conditions. And so, I mean, you again, if you do have to do that, just be aware of your hands and clean them and be mindful when you're touching your face and things like that. No, I mean, it's hard to say for sure.
Yeah.
There's a lot of variables, but best to, again, just avoid contact with people as much as possible.
So one of the questions we got, and it made me laugh when I read it, but at the same time, like, I think it's a valid question, and I think a lot of people are wondering. So should you sanitize the rock before you touch it? And is there a way to do that?
No, you've probably better uses for your sanitizer.
I think so. Yeah.
I think to protect high touch surfaces in your home environment and, in your vehicle and at the gas station, things like that.
Yeah, when these supplies are scarce, maybe use them a little.
Yeah, things you're getting from the grocery store or anything. Yeah, definitely.
And I read a study that the CDC performed on one of the cruise ships that got infected. They were studying how long the virus could survive on different types of surfaces after the passengers had already left. And I'm kind of wondering, like, with our climbing gyms being closed, and one of our listeners asked this, and I think she's an employee at a climbing gym. So with the gyms being closed, should they be completely sanitized, or do you think with the duration of the closing that it wouldn't matter anyway?
Yeah, likely wouldn't matter. It won't survive that amount of time. I mean, I think the highest end I've seen for some coronaviruses is maybe 9 to 10 days, and and then again with the chalk and the environment, if nobody's in there, it shouldn't really be an issue.
Okay, well, that's good news, because I think our climbing gyms, most of them have what would I say, like suspended all the memberships as to not charge all of their members, when they're not allowed to use a gym.
Right.
and we care about our gyms very much, and we want them to spend wisely. So I think it might be costly for them to sanitize the whole gym. So I think that's great that it probably, they're not going to have to do that.
Yeah, likely it won't survive on those surfaces. But hey, it can't hurt to pull down the holds, clean off the chalk, and set some new routes. So we come back and everything's fresh. That would be all right. But anyway, they've got some time on their hands. They
do, and I think probably all the gym setters are itching to set something right now, so they might do it at a discounted rate.
Yeah.
One of my favorite things that has come out of this whole mess that's going on in our community right now right. is seeing all the selflessness going on in so many people. Like, I knew you always, there are good people out there, and I don't think they're quite as scarce as some people might think they are, but I still was shocked at all the awesome things that our community is doing for each other, like the way that they're giving to us at the hospital and just reaching out to like their neighbors and anybody in need. Like I love the videos on Facebook, like that's my favorite thing going on right now. I think it's brought a lot of good out in people.
I totally agree. I am just blown away by the amount of support that we've received as a facility from the community, and not even our local community. Even a friend of my mom's donated masks and some supplies to our hospital, and even connections overseas, and all the love and the support that's been coming in is just amazing. It truly is. I mean, it's nice to see, and kind of restores your faith in humanity to know that when
totally.
times are toughest, people are stepping up, and it's amazing.
Yeah, my uncle, actually, he lives out of state, and we don't know each other that well. We actually just met 2 years ago. We were linked to each other on a genetic testing website. Yeah, and he's actually my mom's brother that she didn't know she had. So crazy story there, but the point of what I'm saying is he lives out of state. We have met him in person before, but we haven't known him very long. We don't see him often. But he reached out to me a few days ago to just check in with me. He knows I work at the hospital. He just wanted to know how I was doing, how we were doing as a community down here. And he is actually sending us a few boxes of N95s. So those should be coming in soon. And it's just super sweet, like someone that's kind of like new to my life, and he just showed he cared not just about me, but about the people around me and in the hospital. And so I thought that was awesome.
That's incredible. Tell him, I said thank you very much.
I will.
I'm sure
I definitely
the hospital will write him a letter. Yeah. No.
So nice. my other favorite part of everything that's going on is all the beautiful memes that are coming out about coronavirus. Yes.
Oh my God, I totally agree.
I'm like obsessed with them. They're so funny.
Yeah.
And so I definitely have some favorites about that.
Oh yeah.
Have you heard like the songs coming out too?
No, I haven't heard the songs, but I've been following some of the memes pretty closely.
Okay, you're blessed. You're blessed to not have heard the songs yet. They're good, but they're also they're hard to get through.
I heard one about staying at home, I believe, with a bearded gentleman. There was some more expletives in there.
I do know that one.
Yeah. And what's interesting is the expletives, those hard consonant sounds that you make, produce more aerosols. So you want to be careful not to be cursing people out right now.
So maybe we should form some speech impediments right now.
Right. Yeah. None of those hard SH or F sounds right now.
Soften them all out.
Yeah, exactly.
One of my favorite memes, actually, I guess it's more like a video, but it's about the gloves in public and like at the grocery store. Those are my favorite, like the cross-contamination with gloves. I don't know if you've seen that one, but
I haven't seen it. But
there are like a million
of them. That's like my daily life.
You're like, that's everything my job is. So
right, pretty much is yelling at people to not do that. Yeah.
But yeah, like the videos of like people doing their grocery shopping with gloves on, and they, get all their stuff put in the cart. They use the cart with their gloves on. They do the keypad with their gloves on, and then it shows them getting into their car with the gloves on.
Oh God.
Using their steering wheel and everything else, and then they touch their face and all these different stuff. They pull out their phone and then they're like touching their phone. Like, oh my gosh, it kills me. And I've actually seen in person while I'm driving, like in my rearview mirror, I can see people driving with their gloves on. And I'm like, I don't, that too. Yeah. Like, girl, I do not know where you just came from. But you brought that place into your car with you. And actually, I saw someone just like yesterday, 2 days ago, I think, in the Del Taco drive-thru with his gloves on.
And he didn't eat his burrito with those gloves.
I know. I wish I could have followed him and found out. I'm like, oh no, what are we gonna do? I gotta tell this guy.
Oh man. Seriously.
But that being said, they're hilarious to watch, but I don't think gloves in public are always a bad idea. Like when do you think we should use them, and how? I think they could be very useful at gas stations, which we kind of already mentioned. What do you think about that?
Sure. Yeah, I mean, so gloves can be good for multiple tasks. But it's important to remember that it is a form of personal protective equipment and should be used for a task and then discarded once you've completed that task. Gloves provide a huge false sense of security for many people, thinking that, well, as long as I have these gloves on, I'm safe. But they don't realize that they're, especially in healthcare, that they're doing everybody else a disservice if they're just walking around with the same gloves and touching all these surfaces. The best thing is really just to clean your hands. So interact with an environment or with a surface in the environment, especially a high-touch surface, sanitize or perform hand hygiene. Gloves, if you don't have hand sanitizer, or again, if you're going to touch that gas pump, sure, put on a glove, but make sure you take it off afterwards. Mm-hmm. And even our skin, is a natural antimicrobial barrier to an extent. There's a reduced pH that makes it more hostile. There's salts, there's other microorganisms that are going to compete with these viruses versus putting an inanimate surface on your hand, which is just a great habitat for bacteria and other microorganisms to live, because there's nothing fighting them off, right? Mm-hmm. They can just build up there and even start producing a biofilm. So gloves are not the solution, and if you use gloves or any type of personal protective equipment, including masks, you have to do it responsibly. The biggest thing with masks is people touching them all the time. Putting them in their pocket, right? Meanwhile, that mask is filtering out everything from the air. So you want to minimize contact with the mask. And if you do, you have to perform hand hygiene afterwards. So hopefully that helps. I don't know.
No, that was great. So with the masks, I do think they're helpful to use in public. The CDC in the recent past was recommending that only people who are symptomatic wear them. They recently changed that. Which I definitely agree with.
Yeah.
But we do need to touch them when we're using them. So should we just be cautious, I guess, to not touch the inside? If we're keeping it and saving it for use, like the next day if we have to go to the store, should we? Because I usually at the hospital like fold mine in half and put the insides together, if that makes sense.
Yeah, I mean, that's a reasonable temporary way to save a mask. You want to make sure that they're able to dry out between uses. Ideally, you could do a 5-day rotation with mask use, which is, part of the new CDC guidelines that came out this week. So, there's some downtime, allow things to die off. If you can hang it up somewhere where it's not going to be disturbed or get contaminated, that's also a good way to do it. Be very careful when you're removing it. But yeah, it's kind of, I think it's an interesting recommendation. I know, early on they didn't recommend everybody wearing masks because our supply chain was so disrupted. And we need to prioritize masks for healthcare workers.
Right. I fully understood why they did that. Yeah. It wasn't, I didn't agree with it on terms of keeping yourself healthy, but I was like, well, we can't all have them, and I think the hospital really needs them. So I
Exactly.
totally understood why they did that. And actually, you see like all the homemade cloth masks now, which is I think cool. But I'm wondering, and one of our listeners asked, this is one of my favorite questions that we got from them, was, are those just as effective as, should we be using a surgical mask instead, or are those okay?
Yeah, so the short answer is it depends on what you're using it for. The cloth masks, and it would depend on the material it's made out of and how it's made and how it seals to your face. The main purpose of those surgical masks, and even the cloth masks, is, sure, there's some filtering going on, but you're not totally stopping, all the virus from coming through or being inhaled. But what you're doing is, and especially for the general public, is you're kind of just slowing down the velocity of your breath. And sure, over time, those fibers are going to stop a lot of droplets, and they're going to, stop some of what's coming out. Is it 100%? No, but it will greatly reduce it. And, the surgical masks we use in the hospital are quite a bit better, and they have a lot better stopping power. And that's typically what we use, as a form of source control on people who are infected. But the CDC criteria says, if you have a standard procedure mask on like that, and you do have a brief exposure to somebody who may have COVID, your exposure risk is actually still quite low. But again, there's so many variables. It depends on the nature of your encounter and the type of exposure you might have had. But they'll definitely have some benefit. But again, as long as people are using them correctly, because you can increase your risk of contact transmission by mishandling or misuse of a mask.
Right. So can we agree that not everybody needs to be wearing an N95?
Yeah, those are.
Can we agree that they maybe need to be at the hospital?
Yes, we definitely need the N95 masks in the hospital. I mean, definitely if you're a high-risk individual, or you're at risk of having worse outcomes from coronavirus, and if for some reason you have to be in public or around others, that may be a benefit to those people, but for the large majority of folks, it's not necessary. And the best thing to do is just stay home and avoid others. Right.
Like there are people that I'm close with that have cancer. A friend of mine has CF, and my friend that has CF, she will most certainly lose her life if she gets something like this. And she deserves to have something to protect her from that. She's not leaving her house even for a second right now. So she's protected and she's safe, and her family is caring for her. But that's a really good point too. If healthy people are keeping those masks from people who need them, it's not just people at the hospital, it's others as well. And immunocompromised, I haven't seen this a lot, but I have heard some statements that indicate misunderstanding of what immunocompromised is. Someone said they had, and this is like in a different field, it's just like a friend of mine told me this. He works in law, and he said that a coworker of his said she had a stuffy nose, so she was immunocompromised and wouldn't be. I was like, I'm sorry. That's not quite what that means.
Okay. Oh man.
So things like cancer, rheumatoid arthritis, CF, like where you have a condition that your immune system does not work like everybody else's does. That's what that means.
Right. Yeah. It either underreacts or overreacts, and certainly those that have respiratory issues are going to be at high risk, like CF and asthma.
So another one of my favorite questions, the homemade cloth mask was one. Another one of my favorite ones was, how can we stay healthy when members of the house are still leaving for work every day as essential workers, coming in contact with the public on a daily basis?
Oh, yeah, for sure. That's a great question. I mean, especially for us in healthcare, we're heading into the hot zone every day, and we need to be very careful what we're bringing home. And ideally, we're not bringing home anything. And, my stance always, I'll just start with the most extreme example of healthcare, is you don't wear anything from the hospital home. Outside of this crisis, that's always what I recommend. Come to work in your street clothes, change in the hospital, shower there if you can after your shift, change out of your scrubs, change back into your street clothes, and then go home. Shoes included, because even your car is an extension of your house. Basically,
right.
You're going to get back in your car later in your PJs or your lounging sweats, and then go back into your house. And so, I think it's important that we draw a pretty hard line at the borders of our facility and ensure that nothing leaves. And we've set up some programs now in light of this crisis too, where the nurses can change into hospital provided scrubs. They don't even have to bring those scrubs home to launder them anymore, which I actually will think will go a long way to help limiting the spread in the community. And just for the general public, I guess if you're going out in public, again, try to draw that line of separation if you can. You don't have to go too overboard. Your risk of getting your body contaminated is going to be pretty low unless someone sneezes on you or something like that, but or you have contact with others. But as much as you can, try to change when you come in, or have your going out clothes separate from what you're hanging out in your house in, and then get really good hand hygiene, avoiding touching your face, and you can always shower if you feel like you had significant contact with others, to help keep yourself extra clean if you're going out in public. So.
Right. Last listener question I have is asking about a vaccine. Are we making one? When will it be ready? I know that there is a vaccine in the works right now, but I also am curious, because I know that process can be lengthy. How hopeful should we even be about that? Is it going to be ready for public use during this acute phase that we're in?
It's a little hard for me to predict.
Yeah, I'm sure it is.
At this time, yeah. I know a lot of people are working on it, all over the world. And there's such an intense focus on all this right now. I don't know some of the barriers that they may be dealing with in getting something approved. But I'd say hopefully within the year we'll have something. But at the same time, the nature of these viruses, it will probably help to an extent. But, we've never been able to create a vaccine, say, for the common cold. That's not really worthwhile. The virus can mutate over time. And similar to the flu, right, we have a vaccine and it still comes around. And,
and that's why we make a new one every year.
Yeah, and every year, we're trying to predict what we're going to see the following year. So, I'm hopeful that we'll have something soon. I haven't seen any updates in a while on that, but I'm not putting all my eggs in that basket.
Yeah,
totally, and but it would be nice for sure. Even if we could, whatever we can do to help lessen the case count would be great.
So it's more so like to help as this may come back seasonally.
Yeah, totally. We can prepare more people for it, and better prepare our immune systems for an insult should we see this again.
So it's not going to come flying out of the sky next week and save us all right now, so we can go back to the gym, right?
Not that I know. But I'll keep my eye out, I guess. And
well, that's fine.
Look into that. There's a lot of information coming at me from a lot of directions, but I'll get some updates, and
we'll have to keep climbing all the cabinets then, I guess.
Yeah, exactly. Climbing the walls, literally. Yeah, I just put up, or I just got a hangboard I'm going to put up today.
Oh, that's awesome. How'd you
Pull-up bar and
how'd you get one of those? Those are pretty scarce right now.
Oh, I got it actually a couple months ago.
Oh, okay.
And my wife works at, I don't know if I can say the name of an outdoor retailer in Southern California.
Right.
One of the local ones, Nomad Ventures. I mean, I can say that. But
I was so like, I don't care.
Yeah, I was like, okay, I'll put a plug for them. But it's, yeah, she was a manager at one of their stores in Temecula, and yeah, she was able to get me one before this all happened. So I've got my simulator here.
Well, that's a beautiful thing.
Yeah.
And as you know, in the backyard?
Yeah.
That's cool. You can get a tan. The sun just came out in time for this.
Yeah, exactly.
It's perfect.
Yeah, it is.
But as you know, and as many of our listeners who follow us on social media know, we built a climbing wall in our garage to kind of get us through these hard times.
That's right. You should. Looks awesome. I may need to do that if I get some free time.
Yeah, if you at any point have a free day, maybe you can work on that a little bit. So the last thing that I want to bring up is there is this theory that I've heard multiple times that Californians, and maybe some of the theories involve other areas too, I don't really know, but I've heard a theory that Californians may have already had COVID-19 come through our area, like early on in this flu season, maybe from December till now, that we've already been seeing it and just didn't know it. At first I thought that was like a very stupid conspiracy theory, but I've since heard medical professionals and college professors talking about that possibility. Do you think there's any validity to that?
For sure. Yeah.
You do? Oh my gosh, that's not what I was expecting.
to an extent, it may have been quite a bit. It was probably limited, but early on in this outbreak on a Tuesday, you could have said, hey, I just came from mainland China, but it wasn't Wuhan or the Hubei province, and I have symptoms, and we wouldn't have been allowed to test you. And then on Wednesday, that same week, you could have said, oh, I'm from mainland China, and now you meet criteria for testing. And so, I don't think they broadened the criteria necessarily enough early on.
I totally agree.
And again, once we detected it, that's the tip of the iceberg, and it's hard to say. But, I'll tell you, we saw our first suspect January 14th. Was a gentleman, with a company who was evacuated from Wuhan, and so I think there was potential at least in early January. Until now. I mean, early December, maybe pushing it, but it's hard to say for sure. But I wouldn't doubt it. Put it that way.
Yeah. So Liam, who's our main host, and my boyfriend that I live with, he actually was very, very sick in like mid-January. The sickest I've ever seen him in my life. And I thought he had flu. He just, got it pretty bad. And he has asthma. So, you do see flu get really bad sometimes, especially with people that have something already like asthma. But it was like flu-like symptoms, fever, chills, dry cough, body aches. But the fever was crazy, like as high as 104. He was tacky, and I was really worried about it, and I was trying to get him to come in to get some treatment, but ultimately I didn't quite convince him to do that. My mom actually owns a wellness center, so we have some really good resources as far as IVs and everything go. So we got him some help at home, and I think it was an amazing resource. But we were joking as he started to get a little bit better, as the days became more tolerable for him. We started joking about him having coronavirus because it was the sickest he said he's ever been in his life. He actually did have malaria as a child, so he said that reminded me of
Oh my
malaria.
gosh.
I know, isn't that crazy?
Wow. Okay. Yeah, oh man.
Yeah, he said I've never felt anything like that except for when I had malaria. And so we were joking about maybe he had coronavirus, and that not being like, we didn't feel like that was a possibility because that was like laughable at the time that anybody around here would have it. But as that theory kind of came up and some of the docs that I work with were talking about it, I was like, well, maybe he did. But I didn't get anything, or we have a renter here in our house and she was fine. So nobody else got it.
Yeah.
I don't know.
Okay. Yeah. Did he get vaccinated? I mean, again, a lot of variables, and I don't, you know, I'd be more convinced if he had been tested, and then, there's so many respiratory viruses that circulate, and people are always surprised by how bad the flu feels every time they get it. And I think a lot of people are still under the impression that the flu is like a GI bug, but obviously you know better. And no, I mean, within the realm of possibility, maybe not likely, depending on his risk factors,
of
and
course,
if he had travel or anything like that. But and then the fact that nobody else got it again,
right?
I just thought it was this. Almost nobody has immunity, but you could be asymptomatic carrier for all I know.
Yeah. Look out, everyone.
Yeah.
I just thought it was funny how our attitude toward it changed over the past couple months. We're like, maybe we're not joking about that possibility anymore.
No, I would take it somewhat seriously, but it would be a lot less likely. But I've actually gotten calls from people in the community saying that, I think I had coronavirus back in December. I want to get my serology checked because they could potentially donate their serum, and we could use that to treat patients. But
okay. I thought you were saying like, I had symptoms back in December. I would like to get tested.
Yeah, she's like trying to help out. She's claiming that she had, very similar story to what you just told me.
Okay.
So sick. It's the sickest I've ever felt, and I don't think it was the flu, and it just seems to align with coronavirus, and unfortunately, it's a great mimicker, and it looks like a million different things.
Oh yeah.
Not a million, but some of the weirdest symptoms I've seen is just loss of sense of smell and taste. All the way to GI symptoms, and somebody who claimed they had symptoms 2 hours after eating a burrito. It's just crazy. And so I give a lot of credit to the ER and our emergency room folks for picking these up and being, just incredible clinicians to identify some of these unusual presentations.
Yeah, I agree. I think the docs are really stepping up, and there are really productive conversations going on at every second between different physicians, and just how to properly care for everyone to make sure everyone's safe. So definitely gotta give them a thumbs up for that. They're really working hard.
Yeah, the collaboration we're seeing is incredible across all these disciplines, and even in nursing, getting trained to all the cath lab nurses being trained to become ICU nurses, and it's amazing.
Yesterday, actually, when I was at my shift, some of the doctors that were not scheduled had come in to show us some things that they had built at home to... Oh, yeah. Okay, so I figured you did, but how to care for a patient that is a known positive COVID-19, how to intubate them, put whatever you might need to do and keep everyone in the room and other patients safe. They're building these really cool things like a box kind of like to put over the patient's head to kind of like keep all that contamination there instead of laying it out into the room. And there are a lot of really cool ideas going around, and they're all putting their ideas together and like making something new. And I loved it yesterday. It was really cool.
Yeah, it's amazing, what they're coming up with, and the innovation that's happening as a result of this. And I think it, despite everything that's going on, it's going to be very beneficial to the field of infection prevention going forward. And these things that we're doing now are going to become just routine best practices for anybody, because the way the world is today, we don't know what's going to come through the door. And, people probably see me and think I'm, crazy, during normal times, because I'm scared of all these things and all the potential for this stuff. And, I think now everyone's really seeing the impact of really basic things that we can do, and the awareness that we need to have in today's world.
Well, that's all of the listener questions I had for you. That was all my questions I had for you. So I just wanted to thank you again for taking the time to chat with me today. I know these are really crazy, busy times for you, and I can only imagine that you're maybe a little bit stressed. So thank you for doing that, and thank you for serving the community and for serving us employees at the hospital.
My pleasure. This is something, we hope never happens, but we want to make sure we're as prepared as we can possibly be for when it does. And I just want to do everything I can to support you guys on the front line and keep everybody safe.
Thank you. Is there anything that we didn't cover that you want to say to everybody? Do you have any closing thoughts?
No, just sending my best wishes to everyone out there, and best of luck during these difficult times. Definitely an emotional roller coaster, and very surreal. Just feels like we're in a movie. So I just challenge everybody to find something to focus on that they enjoy, and turn off the news and look at the data and focus on what you can do to protect yourself and keep everybody around you safe. And we'll get through this. These things unfortunately happen. Mm-hmm. That's kind of the nature of our reality, and so just stay hopeful and be safe.
Yeah, and reach out to us too if you guys need anything. If you have questions about climbing or about the virus, we're not experts in really any of those things. I'd like to be an expert in climbing, but we're always here to talk to you guys and to just be a shoulder to lean on. We love the climbing community very much, and I think the community and all its members are all absolutely willing to support each other. So just lean on your friends in the community, and we're all here for you. And we love you guys. Well, Jake, thanks again. I will see you soon. I'll see you around. Have a good one.
Thank you. You as well. Enjoy the rest of your weekend.
You too. Bye.
All right. Take care. Bye.
So that's really it. If anyone has any further questions or any concerns, you can feel free to reach out to us, and we'll try to pass along those to the appropriate sources. But really, Brooke hit it home. We're all in this together. As my boss says, we're all taking a bite of this turd, right? So we are all stuck at home. Everyone's dealing with the same thing, so we have to bond together. We have to be strong as a group, as opposed to dealing with this individually. So we here at Vertical Thoughts are more than happy to do that, more than happy to support the community, and we've been personally touched, and I've just been completely blown away by the support from the community of people offering their assistance towards Vertical Thoughts. And I just want you guys to know that we're okay, we're doing well, and we're doing our best to get you guys some content in this time of need. So I hope everyone is safe, I hope everyone is healthy, and we'll hopefully see you guys either next week or in the next couple weeks. We're going to be trying to increase our content production over the next couple weeks, but Brooke and I are still working full time, so it's more difficult than I would like it to be, but hopefully we'll have some stuff for you guys to listen to and or watch over the next few weeks. Just keep an eye out, and again, if you have any questions or need anything, feel free to reach out to us and we will try to pass it along. But thanks for listening, and we'll see you guys next week.